Hello and welcome everyone to our live Q&A for our Ask Maniza every Wednesday. I'm so happy that you're here joining us for our Q&A today. It's going to be a good one because we are talking about oral and dental health. And this is a big topic because every person I know nearly who has struggled with chronic illness um, ends up with issues with their teeth or their mouth or their hair, skin, nails. Something's going on. You know why? Because chronic illness really ravages our bodies in a really not great way. So if you're jumping on here, come and say hello. I'm so happy to have you on here with us. So like I said, come say hello and come and chat with us. So yeah, so I say Jay Markwell, good morning, Jay. So nice to have you here. Kim Clancy, so nice to have you here as well. Yeah, come hang out. So we're live on YouTube, we're live on Facebook. Jay Markwell says, I can almost never watch on Wednesday mornings because the 3-year-old here is occupying me. Hi, Yvonne. Hi, Pooja. Nice to see you all jumping on here. So I'm just going to post a quick story to Instagram that I'm live on YouTube because people were like, are you live yet? And I was running a little late today, but I'm here. So yeah, so today's topic is about your oral and dental health. So if you have questions about that, let me know. I'd love to sort of respond and answer those questions for you. Hi, Alicia. Nice to have you here. Yeah, there's a big, when we get ill, we lose our hair, we lose our nails, our skin, our teeth, our bones. Everything suffers because chronic illness ravages all our whole body. So I would love to hear from you if you have struggled with losing a part of your body, a part of yourself. um, you know, what has been your experience, and are you dealing with dental health issues? If you are, tell me what they are, and I'd love to sort of give you support for that. I don't know if you all know, but we just launched our new Restoring Oral and Dental Health program. This program has 5 guest speakers, 4 of whom are dentists, and you don't want to miss this. There's a bonus with Nadine Artemis from Living Libations is going to be speaking at our event, and you want to grab her bonus call that if you purchase this program before next Monday. And so I'm here today to answer your questions about oral and dental health. So let's get started. How many of you, like I said, how many of you are struggling with your teeth? How many of you are struggling with your gums? Do you have, Yvonne says, I continue to have cavities and gum problems 5 years plus into always doing the morning routine, had my molar extracted, and unsure what to do. So, yeah, Yvonne, let's support you with your question. So, if you're having teeth cavities and gum problems, one of the things you want to always remember is that teeth are time capsules, right? Meaning that they have the problems that's showing up today in your teeth started 20 years ago. So all that you do to fix your teeth, it won't take 20 years from now to fix them, but it is a bit of a lag. So you won't see shifts and changes in your teeth immediately, but whatever work you're doing to support yourself, you might want to do more of it. You might want to do more you know, uh, um, have more, for example, um, more celery juice and swishing more with celery juice. What more could you be doing? Are you using some of the dental health tools that I've talked about before that are on my blogs, like the Living Libations tools and things like that? You had a molar extracted, you're unsure what to do. I'm sorry that they couldn't save your tooth, but in place of that, molar, I would make sure that you have either a denture or something in there that's going to fill in for that gap, or a bridge or a crown. I know implants are not always the number one thing that we want to bring in, because implants are not considered safe totally for those who have chronic illness, but I am talking more about implants in the program. So if you want to, and of course, there are situations where you can do them and need to do them. So, I mean, really, you want to go to the root of it. And in the program, I'm talking a lot about mineralization and how mineralization is the key to resolving teeth issues. So, Yvonne, let me know, how much mineralization are you actually doing every day? Jay says, I've been told I have a dead front tooth years ago from a nasty fall. Dentist keeps insisting on root canal, and another said to pull it. So it's always the first option is always to try to save the tooth. So if you can save the tooth, that would be a better way to go. So that's what I would recommend. Try to save it if you can. Pooja says, yes, I have a dental health issue. Every time I see my dentist, she says I have a lot of plaque and jaw pain all the time from sensitive gums. So we have someone in the program, Pooja, who is an orofacial specialist, and she specializes in pain in the mouth, right? And she's going to be speaking. She's also loves medical medium, and she will be sharing so much about her experience with helping her patients resolve dental pain and all of that. That's super important to tune into that conversation. She will be sharing so many tips. So one of the things I want to say, that if you have plaque, right? If you have a lot of plaque, you want to clean up the gut. That's a lot of gut stuff that's coming up. So what's going on in your gut? What care are you taking of your gut? Are you doing celery juice? Are you doing mono cleansing? Are you doing aloe? Are you doing papaya? Those are areas that I would look at for your gut issues. Lisa says, I have dental demineralization. Suzanne says, me too. I continue to have tooth decay and other problems, 7 years being into MM. I mean, the comments are just so coming right on here. So many of you are dealing with dental issues because of being ravaged by chronic illness, right? Chronic illness ravages our bodies. That's what's really happening. And that's what I'd like to help you focus on. So dental demineralization. Demineralization, you have to correct it two ways. One is to have a lot more greens going into your body, and the other is to bring in extra lemons. I know lemons, everyone's like, oh my God, lemons. Dentists don't like you to have lemons because they say that lemons damage your teeth. What, really be looking at, are you doing any vinegar? Is there any coffee by accident, even caffeine coming into other places that will ravage your teeth, will dissolve your teeth, will destroy them? So perhaps, Lisa, you've been doing this long enough that that's not the case. And for those of you who are saying you've been doing this for a very long time, that's not the case, but it's about repleting the body. And to replete the body with minerals and nutrients, you have to lower your fat. I'm going to be talking about this so much in the program because so many people do not know how to remineralize, right? Because we're doing all the things, but if you're eating too much fat, it's going to be hard. It is what it is. Alicia says, question, I'm self-conscious about my dark teeth. It happened after I started MM. Any suggestions? So dark teeth means like you have some white teeth and some dark teeth. They're all dark. Really, staining happens on teeth when the mineralization becomes weak. Suzanne says, me too. I continue to have tooth decay and other problems. So you really want to address things in the gut. Tooth decay is a gut problem. You have to work on your gut very specifically to deal with this issue. Lisa says, me too. Hello, I seem to have an annoyed nerve in my gums, which I cannot get rid of. Is it shingles? It could be shingles. It could also be HSV1, one of the herpes simplexes that can do that as well. So you might want to do those protocols to help with a shingles or a simplex, but especially if it's just one, if it's gum pain all around, that tends to be more universal like a shingles. But if it's just one tooth, You could have an infection, you could have an abscess, there could be something going on in just that one tooth. So it's still the herbs and supplements will help. You just have to be able to sort of get more support. And in the program, like I'd like to, if you happen to join us, Lisa, you'd be able to ask questions about all those things. So let me just post up the QR code. If you have not yet checked it out, you can just tap on that QR code and tap on it. It'll take you straight to the program, and you can sign up. Would love to have you check it out because it's going to be an amazing workshop. We've never had brought together so many dentists. There's 4 dentists, and then the bonus call is with Nadine Artemis from Living Libations. She's going to be talking about all the things that are important for your teeth, for your health of your teeth. And she's going to be talking about mineralization. She's going to be talking about how her products can really be used in ways that you might not be aware of how to use them. So even I might not know some of those things. So it's going to be really cool. So I hope you'll check that out. Another question that we have on the call right now is from Lisa Hernandez. Lisa says, I had a tooth falling out, so the root is exposed. I have been trying to keep it as sanitized as possible until I'm able to afford to see a biological dentist. So one of the things that we're talking about, Dr. Michelle Artani, if you go and see her post or her bio on our page, she's talking about how you don't need to see a biological dentist to actually get good work done. You just have to be able to tell them what kind of good work you need done, right? So that's important to check that out too. So Jay says, I should also add that I still feel hot and cold with a dead front tooth, which means it's not totally dead, right? It's not a totally dead tooth. Yvonne says, yes, I'm doing more 369s, but you want to go deeper than the 369. You want to go deeper with mineralization. That's the real key here. Kim Clancy says, I had a crown replaced yesterday. Oh my gosh, fresh dental work. And I was pleasantly surprised when she said my gums and teeth look healthy after not going to a dentist for 15 years. Celery juice for the win. Woohoo! Good job, Kim. That's awesome. Dentist said that he has no adrenaline-free anesthesia for tooth jobs like for bridges and crowns replacements. Yes, they do, actually. Yes, they do. Ask them for specifically for carbocaine. Lisa says, yes, thanks, Manisa. No caffeine, very low in fat. On my last blood work, it showed my vitamin D levels are low, starting to get more sun and increasing greens. That's where you need to go, Lisa. Good job. Dale Glenn, I have high blood pressure and elevated heart rate. My EKG said I had a high voltage V1 and V2, strong beats, no clots. My blood showed lots of inflammation and I need B vitamins. And they put me on niacin and omega-3 because I don't eat meat. My D3 levels are low. Is this about teeth? You mean, is this live about teeth? It is, but if you have questions about what you just shared, I'd be happy to answer you. I think you need B12 regardless. I mean, it's a misnomer that people think that they eat meat and they don't need B12. You still need B12 regardless of what kind of diet you eat. If you have high blood pressure often accompanies a high heart rate because the heart has to work harder to put out to push blood that is thickened. So if you have thick blood, the heart rate can go up and the blood pressure goes up because it takes more force. Like, for example, like if you have a thin juice, like a watermelon juice or a celery juice or water, and you drink, put a straw in that and you drink that, it's so much easier to drink down than if you have a thick heavy metal detox smoothie. Yes. So it takes more pressure to push thick blood around. It's the same concept. So the way to deal with that is to actually reduce your overall fat intake. That will thin out your blood because fat thickens blood and dehydrates it. So that's why it becomes thick. It's not enough fluid because it's dehydrated, and it's thickened because of the greasiness of the fat. So once you cut the fat out, your blood pressure will lower and your elevated heart rate will lower. So, and you said blood show lots of inflammation. That's probably viral inflammation, which doctors are not sort of always connecting to that. So Yvonne says, I bought a living libations in the past, including the red light therapy gizmo that didn't seem to do anything. I would use their products. And in the program, in the dental program, we'll be talking a lot about how to use our products effectively for different tooth conditions that you have. So learning home dentistry in a lot more depth, which will be really cool. And I'll be talking in the program a lot about building your own dental home dental kit, what things you should really buy and keep at home to manage your own teeth, because there's nothing like being empowered to be able to take care of your teeth by yourself at home instead of going and needing things from a dentist. I mean, of course, we all need to go at some point to get checked, or and some things cannot be done at home, but a lot of preventative care can be done at home. Lovely leafy green. First of all, I love your handle. That's super, super fun handle. Our interstitial brush is useful for bringing living libations yogi tooth serum between the teeth. All my caries are sitting in there. Yes, they can be helpful, as well as dental floss can be helpful. Coralie Cameron says decay starting below the gum line and moves upwards, always on the same teeth. Both sides look like brown staining, also staining between the teeth. Sensitivity comes and goes. A dentist told me it looks like old decay, but it keeps happening. I do swish celery juice every morning. You might need more than that, Coralie. If you have not checked out our dental program, let me just put it up again, because there are 4 dentists who can help you answer these questions. And I mean, I'm not a dentist, but I will tell you that um, that basically when you have decay starting below the gum line, that is weakened enamel. That's when the decay can start. It touches weakened enamel, and it moves upwards. So it's moving up the tooth, and the brown staining, like I said, staining happens where there's been corrosion on the enamel. So it's all connected to that. And sensitivity happens when the enamel, again, when the enamel weakens. So I hope that you'll check out the QR code. I'm putting it up again on the page so that people can see it. Yeah, check it out, because you'll be able to ask real dentists these questions. And all 4 of our dentists who are coming to the program are all familiar with medical medium. One of them has been using medical medium for many, many years and uses it with her patients and her practice. We have another dentist coming who has been using medical medium information in her own life and also is advising her patients. We have another one coming talking about airway and tongue ties and breathing issues, snoring, sleep apnea. I mean, we're covering all these incredible oral health issues that I wish you could get real advice from dentists. The dentists are going to be sharing materials that are helpful for you to use. They're sharing the most low toxic materials that you could be using for dental care. It's really remarkable what is possible. And I've been learning when I've been interviewing these dentists, it's things I didn't know that I was learning. So I'm really excited for you all to come and check it out, because it's going to bring you to a whole new level of supporting your dental care and your dental health in ways that I don't think has come into our community. So I mean, beyond what medical medium does, like I know we do celery juice, and I'll be covering all those things about foods and things like that. But the dentist will really be going into how to best take care of your teeth in a as healthy a way as possible. And you get to then, these dentists are available for you to go see and go check them out so that you can actually work with a dentist who's working with you in a really holistic way. Um, so yeah, scan the QR code and check it out. Or if you go to my website, you'll be able to find the program there. If you have questions, DM me, ask me. I just want everybody who's struggled. I feel the pain of all of you struggling with your teeth, and I want you to be able to get the right care that you need. Okay, so Yvonne says, I used to be a dental hygienist and my dad was a dentist. Oh my God, Yvonne, we should have you in the program. That would be so awesome. I'm so sorry you're struggling, even though you've got like that experience, a professional experience of being a dentist. That's really cool. Um, and so yeah, so if you are struggling with your if you're struggling with your teeth and staining, so with staining, we're talking about what to do for staining too. So brushing obviously is a little bit of what you can do, but using hydrogen peroxide. So Coralie, you had a question about your stains. Try to use a hydrogen peroxide mouthwash. That can really help with staining as well. All right, so I love that so many of you are sharing your dental woes. I don't love that you have them. I don't love that you have them. And here's a great comment from Dr. Win Fan. He says, last time I had my cavities checked, it was by the TSA at the airport. So I always appreciate your humor, Dr. Fan. Thank you for being here and supporting as always. But yeah, so Sarah Burton says, my daughter has a wisdom tooth coming in straight, as we know from prior x-rays as a child. She's complaining of gum pain. I'm treating it with a tooth water pick, hydrogen peroxide wash, and also golden seal. So those are all the right things to do. One more thing that you could bring in for the discomfort on her gum is a little bit of clove oil, and that should help her as well. All right, everybody. I hope that this is giving you some insight into dental woes and dental health issues. They never really start in the mouth. All the issues that happen with our teeth, they sort of end up in the mouth, but they don't start in the mouth. So that's a really key point to remember, right? If you are one of our IHC members and have been a member for more than 4 months, you get this workshop for free. If you're not sure how that works, email us at membership@emanizahmed.com. And so we're trying to make this accessible and available to as many people as possible. So Yvonne says, I've heard of laser drilling and then not sure if that's better than a drill. So laser drilling, meaning they're using only a laser beam to drill. I do think I've heard a couple of things about this, and they say that it's more accurate. So I guess as long as the robotics and the technology is working right, it could be more precise and more accurate than a hand drill. So Gigi said, I thought MM said clove oil won't cut it. Won't cut it for what? Just a little bit of gum pain? It works really well. I've used it on my kids when they were teething. I've used it on for our own dental and tooth care, and many of my clients said that the pain can be helpful. Propolis is helpful. Clove oil won't cut it for what clove oil won't do what propolis does. Propolis is antiviral, antibacterial, antifungal. I'm just talking about the soreness. Propolis can help with that, but clove oil is an analgesic. It actually cuts out pain. It actually can numb the area out a little bit. That's why I'm suggesting that for comfort. I'm not saying that this would replace propolis. Laura says, thank you so much for this live. With the Yogi Tooth Serum, do I just leave it on there? I brush the teeth like normal and then just put that on the cavity. You can put that on there too. Yes. He said propolis is more helpful. It is helpful in every way in the mouth. It is. There's no doubt that propolis is helpful in every way. And I have used propolis on specifically for pain, and clove oil is also really helpful. I'm just speaking from personal experience. So if you want to use propolis instead of the clove oil, that's totally fine. But I think even a combination of the two could be really potent and really powerful. I probably missed the live where he was talking about propolis being better than clove oil for certain things, but I should go back and listen to that. Karen says, what strength of hydrogen peroxide mouthwash for stains? Usually it's between 3 and 6%. They don't usually put a high percentage in the mouthwashes. Should you gargle propolis? It is amazing to gargle propolis and swish propolis all around in the mouth. Yeah, it's super, super helpful for that. Okay, everybody. So excited to chat with all of you here. So excited to share with you about the program. I hope you'll check it out. I'm going to put up the link one more time. Just scan that QR code, and I hope you'll be able to at least check out the program. Go check out our page. There's a lot of support coming up. It's a 2-week program. It's not long, but it'll be packed with information, packed with recordings and videos from me and our dentists who've done like pre-recorded teaching materials for you. It's going to blow your mind what you will learn and how you can arm yourself even more to take care of your mouth and your health. I wish you all the best. Have a beautiful day, and I will talk to you very soon. Bye all.